The first breast milk your body makes is known as colostrum, which is a perfect source of nutrition for your baby because it contains antibodies that protect them from infection and help their immune system develop, helps your baby's digestive system to develop, and encourages your baby to open their bowels and pass meconium, which is that first black sticky poo that reduces their risk of jaundice. It's very concentrated, and at birth your baby's stomach is very small, so they'll only need a small amount of colostrum to receive all the nutrients they need. Learning to hand express before your baby arrives is helpful so that you're already confident in how to do it during the early days if you do face any challenges. It's especially beneficial to collect your colostrum antenatally if your baby is likely to have difficulties with feeding or maintaining their blood sugar levels in the first few days after birth. This might be because your baby is large or small for their gestational age, is a twin or triplet, has a cleft lip or palate, or has Down syndrome or a heart condition. And it may be beneficial for your baby if you plan to give birth by caesarean section, have a raised body mass index, are diabetic or have developed diabetes during your pregnancy, have polycystic ovary syndrome, breast hyperplasia, have developed preeclampsia in your pregnancy, or are taking beta blockers to control high blood pressure. There may be some circumstances where antenatal expressing is not recommended. Talk to your midwife or a trusted health professional if you're not sure. If you would like to start collecting your colostrum before your baby arrives, you can start hand expressing for a few minutes once a day when you are around 36 to 37 weeks pregnant, but it's never too late to start. Gradually build up from that to expressing about 5 to 10 minutes at a time, 2 to 5 times a day, and then as often as you need to after you give birth. If your baby is premature or poorly, you'll be encouraged to start expressing within 2 to 3 hours of birth using this same technique. And Lydia has made a video on hand expressing that you can watch when you're ready, either for antenatal or postnatal collection. The amount of colostrum you can collect when you express can vary from just a few drops to a teaspoonful. Every drop counts, so don't feel disheartened if you don't collect much. It doesn't mean you won't have enough milk for your baby when they're born or that they will find it difficult to breastfeed. It's very rare for colostrum collection to cause the onset of labour, but if you begin to feel period-like cramps or your womb tightening and relaxing, stop expressing, rest, and then start again slowly. Label the container with your name and the date and time you express the colostrum. Put it in a clean, resealable bag and pop it in your freezer at a temperature of at least -18 degrees. You can store your milk in the back of the fridge at a temperature of 2 to 4 degrees for up to 24 hours before you store it. You can express and freeze your colostrum at home and then bring it into hospital when you have your baby. It can be helpful to let any supporters know that you have colostrum in the fridge or freezer to bring with you if or when you go into hospital. Any tools you usually use to remind you of things can be helpful here. You may also want to record that you have stored colostrum in any birth planning documents or add it to your paper or digital notes and let your midwife know when you've arrived. To transport the milk, you will keep a cool bag with ice packs in and bring it along with you, along with your containers of breast milk. Let them know when you arrive so they can keep that in a milk fridge.